Welcome back to this discussion on your health this morning, and we are focusing on patient safety at any healthcare facility in the country. And this is at the backdrop of the mishap that happened at the Kenyatta National Hospital. And we're inviting you to have this discussion with us. Our phone lines are open, our Twitter handles are open, and we are ready to have this discussion with you because we are seeking to hear from you if you have had any experience like what has happened at the Kenyatta National Hospital or even a near miss. And before the break, we're just looking at what are the ideal standard operating procedures to ensure patient safety in the hospital. And Halima Adan had just taken us through an elective surgery where somebody is prepared and there's time for the healthcare workers to prepare for that surgery. And now, Dr. Abdi, I'd asked you, in case of an emergency, is the protocol the same or does anything change?
Actually, the only thing that changes is the time frame because when it's an emergency, time is of essence. Any delays actually now leads to errors and negligence. So you have to move a little bit faster than normally. But the same tagging patient, the correct procedure, all the investigations necessary for the emergency to be carried out. Because no one does an operation without knowing why they are operating. So there must be some investigations that have been done prior to understand and know exactly what is being operated on. So the protocol never changes. But the challenge and the reality is quality is expensive. It's not cheap. And if you really want to provide quality health care, you must invest in literally everything, from the structures, even to the space. Is it enough to cater for those number of patients? Because if you have 10, 20 emergencies and you only have one operating theater, it doesn't make sense. There will be patients who will be neglected, and there will be errors that will be happening because of the constraint in terms of infrastructure. So the HR is important, the equipment is important, the supplies is important, literally everything is important. And another simple example is telling KDF to go to war, and then you tell them carry pangas when you are going to fight with Al-Shabaab because there are no weapons. Literally, that's what we have been telling the healthcare workers in this country. Go and fight, but we will give you a few pangas to go and fight with the enemy. It's not possible. So if we are really interested in quality, we need to discuss the whole system.
But when we're saying, okay, the staff is minimal and whatnot, wouldn't the argument, and I'd like Dr. Panga to address this, wouldn't the argument be when you have that particular patient, you give them the utmost and the 100% where you verify thoroughly? If the argument is that we are understaffed and whatnot, does this allow us to not be very keen when we are handling that particular patient when we have them?
No, absolutely not. We have to be very keen. I think it is essential that every hospital has to understand that they are responsible for the safety of their patients. Quality and safety go hand in hand. Quality improvement is when you improve performance of the hospital in a systematic way. And when you do that, patient safety automatically benefits. And what we are saying actually is in this specific case of a KNH incident where the issue has been identified as patient identification, it's a reflection on all our hospitals to now think through, take time and think through what are the patient identification protocols they should have. They should have an identification protocol for all patients, have a uniform way of identify a team that will do it, have the unique identifiers for the patients. It's now recommended in our setting that we should have at least 3 unique identifiers for patients. Have a protocol for identifying a patient who is unknown, in this case, like this case where the relatives could not be there. Also have a protocol for identification of the patients who are unconscious. So it's a combination of being unknown and also being unconscious at the same time.
When you say have protocols, does it mean we don't have those protocols? Dr.
No, actually, we could have the best policies and protocols and SOPs. If there's no one to do it, those will remain on the shelves. You need the people, the HR, the human resource. And that's why healthcare is a service industry. It's not goods that you're providing, it's service. As long as there is no team to do that work, you can have the best policy, the best protocol, I don't know from where, from which professor, it doesn't matter. It won't help. So you need, those things go hand in hand. You must have the people, you must have the right equipment, and you must have the right infrastructure, and you must have the right supplies in place. Otherwise, you'll be doing zero work. It's the same thing. You cannot multitask. It's like you being told here, sit, interview us, and at the same time be recording. You can't. It's impossible. So you need that people to work together, and those are things that must be put in place by the leadership. There are no shortcuts in terms of, if you want quality, there are no shortcuts.
Okay. I'd like us to take a caller from Kijabe Blackstone, Maina from Kijabe. Maina, good morning. Go ahead with your comment or your question for the panel.
Yes, thank you very much. Good morning, Dr. Massey and your panel. Thank you for what you're doing, and especially getting us to interact with doctors. And my contribution is looking at who we are as a country and the kind of blessings we have having good doctors and able to train so many and ending up in making our country in the global map. My concern here is why do we have all these things coming along when we should actually exercise sanity as a country with good doctors? Why don't we have people in positions putting everything together, go to the table, discuss into all these issues that happen? Because if we can have a mark with good work our doctors are doing, why don't we as a country and those in power at the same time go to the table, discuss all things that are going wrong, instead of shouting over to the other and sacking doctors because something has gone wrong? If there is that other part which is good, let that bad part as well be brought on the table, discuss and put right what could be wrong next time, without pointing fingers and hard hitting on the doctors. Our doctors are doing good work. They have put our country, Kenya, into a mark globally.
Thank you, Blackstone Maina, for your comments. I'm sure the panel will be able to answer to that as to why we have these issues and why we are not discussing it. But I'd like us to also take Nick Machio from Kilifi. Good morning, Nick.
Good morning. How are you?
Very well, thank you. Go ahead with your comment or question.
Mine is a comment I want to raise today. Because I feel what we are facing right now is basically something to do with the level of competency and negligence. Because I feel how a situation where somebody gets into a theater and a wrong patient is operated on without any due procedures being followed. And then our panelists have just told us the due procedures and protocols that are supposed to be followed. How then can you say that maybe the patient was actually wrong operated on, yet there are so many said procedures and protocols? And I think my feeling is that there is some level of incompetency on the part of healthcare providers. This could be maybe caused by frustrations, and therefore that is the thing that should be highly dealt into. So I feel, like the panelists have said, the World Health Organization has so many protocols and procedures which are supposed to be followed. A situation where a patient gets into the theater and then those due procedures are not followed, a wrong patient is operated on. I feel there is a high level of incompetency on the side of healthcare providers and the administrative part of it. And therefore, I think the government should investigate this matter fully and maybe put these people into a high level of scrutiny. Thank you very much.
Thank you, Nick, for your comment on that. And I'd like to add one more from Twitter by Dominic Kipsirgoi, who's asking if the suspension of the doctor and the chief executive officer of KNH will be able to solve this problem. And from listening to you and what the callers have put in place, it's like a systemic problem, and many people throughout the week have been discussing this like it's a systemic problem. So I'd like us to answer these three specifically. Blackstone Maina is saying we need to discuss this. Is it being discussed so that the root cause of the problem is addressed and solved?
Actually, every hospital generally has, most of the big hospitals have a medical advisory committee which looks into any mishaps that happen within the hospital. And bigger hospitals even have a quality improvement team that does check continuously what exactly. There are so many other errors that might not come to the fore that is not even known and that might not be harmful. So it's discussed and continuously, and there are mortality meetings where people discuss for each cases that mortality that happens in each hospital.
Okay.
As for Machio, there is a difference between negligence and an error. Negligence is where you do something deliberately, wrongly, or not do instead of what you are supposed to do. An error can actually occur where someone misspells the name or misspells the drug, and the wrong drug is given to the wrong patient. So errors happen all over. And negligences are the ones that are supposed to be handled by the professional boards, that regulatory, and individuals are handled as they are and treated. As for whether chasing that
the
doctor,
doctors and the CEO will solve the problem.
That will not solve the issue. That will not solve. Actually, the doctor is the one who came out and said, we made a mistake, we operated on the wrong procedure. So basically, in my opinion, yes, I am not privy to exactly what happened, but I don't think that is a solution. Okay. It should be left to the medical advisory committee and the medical board, if necessary, to investigate and find out and say, well, what was the error, where was the problem, and then come up with a solution, not suspending. Suspending will not help.
Halima, your comments?
My comment would be that the system, the leaders at the Ministry of Health should be looking at what systemic issues could have contributed to such an error. Do we have adequate staff? Do we have the right people doing the right job that is required of them, instead of suspending people? Because I believe every healthcare workers, we have several other success stories in KNH, twins separated, conjoined twins separated, a hand reconstructed from Kiambu to KNH, and very many other success stories. So to me, as Daktari has said, that was an error. It's an unfortunate error. The good thing is it has come out in the public, and I know even as healthcare workers in this country, we are asking ourselves so many questions. There's a concern you were raising about how do we handle, for example, if we have 10 emergency patients and all of them are supposed, an emergency is supposed to be sorted out in 2 hours. So with one theater, what do we do? Do we follow now the protocol as it is required and take the most time with one patient and the rest die? Sometimes we are faced with such situations, and it's a very hard decision to make.
Dr. Panga, your comments from our, in response to our viewers.
Yes, so many times we confuse between negligence and an error, and negligence completely is known within the health system. If somebody is negligent on patient care, it will not, you cannot confuse it. Error is basically a slip or a lapse or a mistake. And when you say what is a mistake? When a mistake is you execute a process wrongly, and then maybe a wrong diagnosis, and then you initiate a treatment that is a mistake. But when there is a slip or a lapse, it also means that you wanted to do one thing, but you ended up doing something else, like dispensing the wrong medicine, prescribing errors, and many others. And actually, I want to bring us back to the protocols. Yes, we've got standard protocols from WHO, from best practice organizations, but each hospital has to look at their own individual situation. Now that we have all these standard protocols, what is our care? For example, if you are a hospital, maybe like his hospital, and you've got many critically ill patients, and some of your medicines have to be driven using automated infusion pumps. There are new errors that just come out of that technology that will not be in a hospital that doesn't do that. Okay. So each hospital is different. In identification, for example, you can't just rely on a standard safe surgery practice identification or that from WHO. You have to say now, in our hospital, what do we do to a patient? Okay. Do we put a white band? What details do we put in our hospital? And it will be different from the neighboring hospital. What do we do with a patient who has an allergy? How do we alert somebody when they meet for the first time a patient who has a drug allergy? What about somebody who has a name similar to another patient who is currently admitted? How do you flag that?
So every hospital has its own different identification protocol.
Yes, so you must customize, basically.
Okay.
Yes.
Thank you very much. Thank you for joining us this morning on Your Health, where we are discussing patient safety in the hospitals. And with me today was Dr. Timothy Panga, who is a clinical pharmacist, Halima Adan, who is a theater nurse, specialized in perioperative nurse, and Dr. Abdi Mohammed, who is the Chief Executive Officer at the Metropolitan Hospital and also the Chairman of the Kenya Association of Private Hospitals. And that's where we wind up. And we have just scratched the surface on this discussion about patient safety, because it is a bigger issue. And I'm sure we'll continue with this discussion. We'll continue getting to the bottom of what happened at the Kenyatta National Hospital and looking at the bigger picture looking at the bigger picture in the country concerning your safety in health facilities. And that's all that I had for you this morning. I'm Dr. Mercy Korir, and maybe Mike, negligence, errors, and we have been trying, I think the public has been trying to apportion blame on what could have happened at the Kenyatta National Hospital. I don't know what you have to say on this.
Well, also based on the newsroom segment we had today, we were focusing on the KNH issue, but more or less reporting on health. And what is coming out clearly is that there is a bigger story that lies behind this. And I think we've not had the doctor's side enough, because we seem to apportion a lot of blame on them, but they also work with very limited resources and under very, very difficult circumstances. So that whole picture needs to be drawn. And hopefully we've managed to do that a little bit more. But like you've said, I think it's a story that we are just scratching the surface, and a lot more